Going here. Well, good evening, everybody. Thanks for coming to my first ever Zoom meeting. So we're kind of learning, as you've probably been able to listen in to us. We don't really know what we're doing, but you're the guinea pigs. But hopefully, we'll be able to get through it tonight, and hopefully, you'll find it worth listening to. And certainly, if you have any comments. So I can tell you, Paul and I, we're in a very unique environment right now in the fact that every day we get people coming in and saying, well, have you heard about this about COVID, or what can we do about COVID? And so we decided that to start our first inaugural kickoff meeting with Zoom, we would cover COVID and immune support. And because, every day we kind of are saying the same things over and over and over again. And unfortunately, there's a lot of misinformation out there. And so we just want to kind of give some good information, things that can just help your general overall immune health system. And, I was just thinking back as I was driving home tonight. I think the last public speaking I did was at the end of last year, which is unusual for me because I'm probably speaking at least 2 times a month, every month. So I've had a chance to rest my voice. So get ready tonight. Kylie, maybe you can explain how they can think what we're going to do as far as question and answers and stuff goes. And right now we only have a couple people signed on, so if you have a question, I suppose you can just type it and we'll try to answer it. But if we get a lot of people, Kylie, go ahead and tell us how we're going to.
Yeah. Okay. So how it's going to work? We'd like to. So as the PowerPoint proceeds, at any point you can type in a question in the question and answer box, and we're gonna try to wait until the end. But like Greg said, if we see it and it's a good time to stop and answer something like that, we can definitely go ahead and answer the question at that time. But we are gonna save time at the end for question and answers. Also, afterwards, we're going to post the video on social media. It'll be on our Facebook page. We're going to also send you the link to the video afterwards through email so that you guys have it as well, and you can share it to whoever you want. It may be edited because, at the beginning we were talking just like we would at work, so you guys overheard.
I don't really want to know a pH meter, so.
yeah, you overheard some of that, so we may cut that out, but yeah, we will give you access to the video afterwards as well. So
great. Well, Kylie is our operations manager, and she's the one that's trying to figure out all this Zoom and making sure the emails get out, and she's trying to get everything posted on the Facebook page and or on a web page, on our Facebook page. So she's really been instrumental in helping us get this thing going. And then, of course, I think both of you probably know Paula. Paula has been my right hand and my left hand for probably over 10 years now, probably close to 12 years, I think. Mm-hmm. So, we kind of work as a duo team. So she always, she knows as much about nutrition as I do. So, but she takes primarily care of all the hormones. She does all the hormone counseling with the women at our pharmacy. So this is our introductory slide. I won't say anything more on that, and we'll just get going here. Okay?
All right.
Let's see if this thing goes like it's supposed to. There we go. Okay. Little delay, but it went. Okay, so one of the first things that we've seen is an incredible amount of information about COVID. And the question is, what's trustworthy and what's not? So I always look at the cdc.gov website. And as you can see, we're all into how do we prevent spreading? How do we protect ourselves? And that's kind of what we're going to try to be talking about today in the immune system in general. There's been a lot of stuff. Do you use hydroxychloroquine? Do you not? And it's not my object tonight to go through all the different drugs that have been researched through and talk about them or get into the politics of it or anything like that. I'm just trying to give some just good old information on the immune system in general. and things that you could do on a day-by-day basis that's going to help your immune system function better. And this is good for anybody's health. And so that's kind of what I wanted. But I wanted to give everybody this sheet at least, because this is really what the government says we should be doing. And as you can see, the very bottom one on the left-hand corner, wash your hands off in soap and water for at least 20 seconds. That's probably been what's been practiced the most, as well as, of course, the social distancing. So these are, obviously the social distancing is new to us since the beginning of the year. We didn't, nobody had ever done that in our generation. And now as we got kids going back to school and colleges and people seem to be moving, we just don't, this is going to be a difficult, I think, we're not over the hill yet. I mean, we've got a lot more to go through. And I think now more than anything, I think this talk is really important, because we got to start thinking we're coming into the fall and the winter season when flu season typically picks up anyway. So what are we going to do, to try to help keep ourselves healthy? And so I looked at this website. This is from Johns Hopkins, and it goes to show you how numbers can be manipulated. And when you look at this chart first, and you see the United States right up here, it says 52.52 deaths per 100,000 people. And you look at it, so there's Peru and Italy, and you go, oh my gosh, Chile, it looks pretty dire and pretty bleak. And it just depends on how numbers are measured. And so if we look at the next slide here, and you look at this one, it doesn't look so bad to us, because then you look down here, the United States is at the bottom. So you see that it has 3.1 observed cases fatality ratio. And what does that mean? What that means is they looked at the total number of cases reported, and then of those cases that were reported or tested positive, how many deaths were there? So, I mean, Italy, boy, that doesn't look very good. And of course, we all remember at the beginning of the year, Italy was, every night, you were seeing this mass hysteria going on in Europe. And as we've looked at states like Brazil, and, we think the same thing. But if you look at Brazil's number, 3.2% versus Italy, that's a dramatic difference. So trying to keep that into perspective, I think I like this ratio, because I think it really tells us a little more information. And then if we take a look at Indiana statistics, and this is what I came from the Indiana the Department of Health's website, coronavirus website on August 19th, which was basically yesterday. That we had a test conducted, shows you did roughly almost 1 million tests, and the positive results are 82,000, and the deaths was 2,968. So if you took that number, the deaths, the 2,968, and divided it by the positive results, you would get the observed case to fatality ratio, which is again 3.6%. So that's pretty close to what the government across the whole nation is. However, what I found out last night after I typed this was I read another thing in the newspaper that said, we're not really reporting the positive results properly. For example, let's say you have, and we all know people that have had more than one test. They go and they get 3 tests. My daughter is one of those. She works down in Kentucky. She works in a home where she's exposed. She's had 3 different tests. Well, if she had those tests done up here in Indiana, that would have been 1 visit. If she got infected off one time, that'd been 1 visit instead of the denominator of being 3. So in other words, the number, I believe that number of the actual results are actually going to change some of these numbers in reporting. So you got to look state by state. Some of the numbers aren't the same. So that's added to some confusion, I guess, is what I'm trying to say. So anyway, it looks like Indiana is pretty comparative to the rest of the country as far as on an average base by base. And of course, about the only thing I can tell you for sure, I believe probably the more urban you live, more dense your population, the higher at risk you are. So other things we have to look at is what are some of those risk factors for COVID death? And one of the things that we want to know is, am I at risk? What is my chances of getting sick? So if you think that there's 3.6% of the population is at risk, and that 80% of them are age 65 years of older, that's pretty, you know, there's a line right there. If I'm 35, do I need to worry as much as if I'm 65? And the chances are probably you don't. But there are some things that also are sticking out, and there's been some papers written about what patients are really at high risk. And the ones that I bolded here, the reason why I bolded them is those tend to be things that are preventable if you think about it. So for example, COPD, what's the number one cause of COPD? Well, the number one cause of COPD is smoking. So you have a disease that can infect you and attack your lungs, and so you are at risk with COPD if you are a smoker. So somebody who's been smoking 50 pack per year cigarettes, then that person is at much higher risk. So again, if you're younger than 65 and you're a smoker, you're probably at higher risk. The other one that's real big is a BMI greater than 29. In other words, 30. So 30 is considered obese in our country. So unfortunately, there's about a third of adults are in that obese category. And then finally, diabetes type 2, which I have talked about in many talks about diabetes, type 1 and type 2. Type 2 is the one that's insulin resistant, and that ties in real close to the obesity. So those patients are patients that their insulin doesn't work like it should. So because they're insulin resistant, their insulin is not taking that blood sugar and dropping it where it needs to be. Because of that, their blood sugars tend to be higher, and that causes damage to the vessels. And those patients, actually, when we start talking about cholesterol screenings and things like that, patients with diabetes have a high risk factor of having heart disease, and that's because they have destruction going on in both the small and the large vessels of the body. So as we talk about our immune system, what can we do then? The next question is, what can we do to keep our immune system vigilant and working? And so I liken our immune system kind of like our armed forces. You know, we have all these different armed forces that their job is to defend or to attack. And that's exactly what our immune system does. It has to work just like our troop in defending our bodies. And to do that, you've got to have a good foundation in the early stages. And we're going to talk about that in a few minutes. You have to be trained effectively, okay? So it has to be smart enough to be able to protect you against potential threats, but also smart enough to avoid autoimmunity. So the immune system, I kind of liken to a teeter-totter or to a tightrope. You got to have it strong enough that it can defend off of viruses and cancer and all these other things, but you don't want to have it overstimulated to the point where it'll start attacking things in your body. That's called autoimmunity. And one example, that's Hashimoto's thyroiditis, which Paul and I see every single day in our pharmacy. And those are the patients that come in and that we dose on thyroid, and their TSH swings wildly from month to month to month to month. They're very hard to get under control. So let's start with one of the first keys of getting our immune system ready, and that all comes with the starting point of digestion. And remember, food is information, and I've talked multiple times on the GI system and how important it is for our gut, our brain, and our immune system. Today we're going to focus primarily on the immune system, but you know, when you start the whole process of digestion, the first thing you do is you start chewing the food. And one of the problems that we have in our society is, and I practiced that tonight. You know, I got home from work and the first thing I did was chew down my food as fast as I could to get ready for the talk tonight. Well, that's not doing my body really any good favors. When grandma said chew your food, there's a reason. And that's because you get all these digestive enzymes starting it right in the mouth. And as you're chewing that food and masticating it, it's also getting the digestive system primed and ready to go. The next step is you start getting acid released in the stomach. So when the food hits the stomach, there's acid. And what happens when you have acid? It drops the pH, makes it more acidic, and it is so acidic that it starts breaking down different things. Now, as we start to block that acid with certain prescription drugs, that can actually be detrimental to our health over time if we don't do that judiciously. So just to do indiscriminate acid blocking sometimes can do us some long-term harm, and we'll talk about that a little bit later. The other thing that happens is as that acid starts getting related, as that pH drops and the food hits that stomach, then basically the stomach has receptors in it and it sends out sensors to places like the pancreas and the liver to start sending out digestive enzymes that help further break that food down. And so again, as that food gets ready for to get into the system, it has to go through that barrier, and it's been broken down into the elemental proteins, carbohydrates, and fats, things that we want. But we want to keep out the bad things. So we want to keep out the preservatives and all the junk that shouldn't be getting in there. And so to do that, we got to have this very good bacteria, this very good wall system. Okay, so this is our Great Wall in our digestive tract, and as you can see by that picture, the bricks of that wall, where the little swirly arrow is, they look pretty tight together. They're pretty close together, and they're doing what they're supposed to do. They're only letting in these really small nutrients in, and when that happens, then they get into the bloodstream, and that's where and there's these cells right underneath the lining of the digestive tract with blood vessels in it, and in it you have your immune cells. And as you can see, Mr. Smiley there is really happy because we got good food and digestion. We got good bacteria in there called the microbiome that's helping us digest those foods and helping the immune system. And so the immune cells are getting good communication. Again, food is communication as well as energy for our body. So obviously energy to help us function, but also to give us information to help the rest of our body perform. So we have these security processes, and I kind of went through this already. We chew, we add saliva, we transport it to the esophagus, we have stomach acids and digestive enzymes, and when that is very presentable to our own gut's immune system, and it then it admits in these proper nutrients. It keeps the bad stuff out. So if I'm eating good, healthy fruits and vegetables, organic foods, then my gut is happy and my immune system's happy too. So there is a maximum security process here, but it's not foolproof. So many factors can weaken the system. So if we have bad food, then we get this system called dysbiosis. So dysbiosis just means there's an imbalance in chemicals, and the things that are in the gut shouldn't be there. And it might be things like we have bad bacteria on our food, we eat bad food, or we eat certain chemicals that actually kill our good bacteria, and all of a sudden then the bad bacteria start to thrive. And one such bacteria is Candida. We've all heard of Candida infections. And so we sell a lot of products to help fight Candida, and those are the patients that get pretty sick. They eat food, they get nauseated. They eat food, they get diarrhea. And there appears to be no explanation, and it's hard to test to find Candida, but you can find Candida. Stool tests can be used, and that's the most common form. But as that poor digestion occurs, like tonight, I ate my food too quick. I didn't masticate it properly, probably didn't give it lots of good enzymes. It sits there, and if I have bad bacteria in my gut, then all of a sudden, some parts of that food that shouldn't be getting into my system is. And as you can see now, the wall's got holes in it. You got big gaps in there, and then things are getting in there that shouldn't be getting in there. It's lost its integrity, and oops, I got ahead of myself. And as you can see, as it goes through, now you've got bad stuff coming in, and guess what? The immune system gets angry, and it either can't handle it or gets overreactive, throws a temper tantrum, and that's when it starts. In fact, that's where we start seeing our autoimmune disorders. For example, we see people that have Hashimoto's thyroiditis I talked about. Another thing is Crohn's disease, ulcerative colitis. And then we're starting to talk about, your digestive tract is going to start having symptoms. You're going to get the diarrhea. You're going to feel fatigued. You're going to have food sensitivities. So when I talk about the harmful environment of things, we can talk about things such as drugs. So for example, if I'm taking lots of antibiotics all the time. So one of the things that we get really concerned about is kids all the time getting all these antibiotics for ear infections. In the long run, are we setting them up for autoimmune disorders when they're 30 or 40 if we're giving them 12 rounds of antibiotic before the age of 5? And there's a lot of interesting studies that show that. And if we look at things like breastfeeding puts good bacteria in the digestive tract for babies that are delivered during a vaginal delivery. versus a C-section have a better or a different microbiome. They have a more robust immune system. So bad germs such as bacteria, parasites, and yeast, which I kind of talked about earlier. We talked about the foods. We also talked about, we haven't talked about, but we've talked about in past talks about stress and body fat. What am I talking about there? Again, here's a big picture perspective. We step back out. If we're eating bad foods, we're having a revved up immune system, antibodies, whether it be food allergies, whether there's things such as drugs or what we call xenobiotics. Those are pesticides that act like drugs or act like estrogen. Physical stress, infections. Hey, there's a word that probably nobody knew until the beginning of this year, cytokine. Has everybody heard the word cytokine storm, right? Cytokines are a normal part of the immune system, but if they get out of hand, then you get people that are really sick. This is a really advanced immune system problem. And of course, neurotransmitters. And again, kind of taking a step back, we know that people that have really bad guts, get really bad gut health, tend to suffer higher rates of things like depression, anxiety, and sleep problems. They also tend to be hypersensitive to pain. And that's all related to those neurotransmitters. So again, everything leads down this path to this thing called inflammation. And inflammation really is what causes death in all of us. You know, it's really the crux of all of our problems. We want to keep our body's inflammation down as long as we can, as low as we can. We want to, inflammation is good for us, but if it's unchecked, it's bad for us. We need some, but we don't want a lot. So again, we've got beneficial bacteria. We want those good bacteria. Those tend to be lactobacillus species. We want them because it's important. So, you know, it goes without saying, we are big proponents of probiotics. There are some prescription probiotics that are used for things like UC, which is ulcerative colitis or Crohn's disease. And then there's, of course, the over-the-counter ones. And so getting a good probiotic can be very helpful because if you got good beneficial bacteria, they affect the immune system. Now, we used to think of it as the Prolon, I call it the Trulon or True Green theory. Hey, if I throw enough good bacteria in it chokes out the bad bacteria. In other words, if I've got good grass in my yard, I can't have weeds, right? Well, that's not really the way probiotics work. Good bacteria actually communicate. They live in communities that are called biofilms. And those communities promote good, healthy bacteria to live in them. And so we're learning more and more about probiotics. And now you can actually do a genomic study and see what kind of bacteria you have. And they can talk to you about what your health risks are. Now that stuff is kind of more theory. It's not been proven, but it's really interesting science. And there's a lot of stuff going on into the digestive health of just the different bacteria and germs we basically are carrying in our guts. So how do we help our immune system stay strong? We're going to do that by using good micronutrients and antioxidants in our food. We're also going to look at different things that help fuel the mitochondria. And a well-functioning immune system needs a well-functioning waste management system. That's where detoxing comes in. And I'm not talking about going on a purge where we're going to detox your body of everything. We're talking about what things you can do day in and day out that are going to help keep your immune system in check. We want to keep your inflammation down. So what our detoxification, we've had talks about this in the past, and we'll certainly have talks about it again in the future where we record. But the whole idea of detoxification is to get fat-soluble chemicals and water-soluble chemicals through your liver and get them detoxified so that you can eliminate them out of your body. And you eliminate it out of your body through breathing, through sweating, but primarily through your kidneys and through your feces, okay? So that's what we're talking about. We're trying to use the liver, and there's lots of different things that can do that. And this talk is just a real overgeneral view. I'm not going to go, and I've done whole talks on just the whole detoxification process. But there are definitely some herbs and things that can be done that can help that promote your liver. Other things you want to do is you want to do a lot of things that are healthy for your liver. Okay, so here's some 10 lifestyle things that you can do to help decrease stuff going through your liver. Okay, and I'm not going to read these all to you because they're all on this list and you'll have access to it. But one of the things we talk about is eating organic. That's really, really important. And people don't always think about it. Well, organic's more expensive. Well, yes, it is. But I want you to think about it. two types of things that are organic. There's fruits and vegetables, and there's meats. And pesticides like to go to fat-soluble products. So which do you think is more important, eating organic fruits and vegetables or eating organic meats? If everybody wants to type an answer, they can. Well, for the sake of time, I will give the answer. Meat. We want to make sure we eat organic meat because that's got fat in it and it tends to suck in the pesticides, which tend to be, and I always tell my little pharmacy students the story about DDT and eagles. They've forgotten that, because they weren't born in that era when DDT was getting into the water and rivers. It was then getting into fish, and then the eagles eating the fish, and it would concentrate. The higher the body mass of the animal is, the more DDT was concentrated. Well, DDT is an estrogenic-like compound, and it dramatically decreased the fertility rate of the American bald eagle to the point where we were almost extinct at one point. So that's when DDT was banned back in the 70s. Okay, so that's a perfect example of a super toxic pesticide. But I think it's a great example of how pesticides work. They get concentrated in fat tissues and they build up over time. Okay, guys. There we go. Okay. So again, waste management plan is to really sit down and try to understand what we're eating, make sure we're eating good stuff, improve stress management, reduce belly fat, and reduce exposures to environmental toxins. We want that liver to work good. We want to make sure we're having a bowel movement at least every day. Over the years, I've had patients come and say, I have a 1 bowel movement a week. Well, if you have 1 bowel movement a week, it's like saying I allow my trash to build up in my sink for a week. What happens to that trash after a while? It starts to stink, right? So that's exactly what's happening. You're getting rotting in your colon. So you want to be able to eliminate that. So what does stress have to do with it? Well, here's my story on the zebra and the lions, okay? So if you are a zebra and you are a lion, you have different points of view in life, right? So if you're a zebra, for the most part, 99% of your life, you're probably laying around, you're probably chewing your cud, you're probably chewing your food, you're pooping, you're having zebra sex, you're having all those fun things that we all like to do in life, right? Sleeping, etc. However, the day that the lion shows up, he doesn't have time to do any of those things. And he's not going to have time for zebra sex. He doesn't have time to eat. He doesn't have time to sleep. And he has one thing he has to do, and that is run like your life depends on it, right? And so that is an example of what we call our fight or flight system. And the zebra isn't going to run its entire life because eventually it's either going to run out of energy or it's going to end up as hamburger meat, right? So what we need to know is, as human beings, one of our biggest problems in our species is we're always under stress, and we're always in this fight or flight mode. And in the long run, that's actually not good for us, because when we're in the fight or flight mode, guess what? We're going to have less immune system to fight off infections. Our fertility goes down. In other words, our mood goes down for libido. Our digestion is worse. Our blood sugar soars high. Why? Because we've got to have energy to keep moving. Our need for caffeine goes up because we want to move that blood sugar. And the body says, you know what? I'm going to increase belly fat because you're stressed. And when in periods of stress, the body slows its metabolism down and now increases fat, belly fat. So this reminds me of, we start indoctrinating our kids to sugar pretty early in life, right? Happy 1-year birthday, enjoy this cake, right? We all do that. And there's nothing wrong with that, of course. But what happens is, if we're constantly consuming too much sugar, then again, we end up with these oscillating sugar levels. We get a high sugar level, maybe when we shouldn't. And what happens is when the blood sugar gets really high, then our body sends out this bolus of another hormone called insulin. And insulin's job is to drop that blood sugar. And so it can do that. So if you're not eating properly and you're eating a lot of high sugary foods, low protein, even low fat, okay, just high refined carbohydrates, then you're going to be on this teeter-totter, because what's going to happen is you're going to eat that sugar, you're going to feel good. Okay, I just ate a bunch of sugar, I feel good, my brain feels happy, because your brain loves sugar. It wants that simple carbohydrate because that's how we think, okay? And then insulin comes out about 30, 40 minutes later, and it drops that sugar, and it drops it too low because it overcompensates. And when insulin drops it too low, then we get a craving, and then, by golly, it's time to eat more sugar, and that goes on and on and on. Over a period of time, the body starts to have to secrete out more insulin. We lose sensitivity to our insulin, and we develop what we call insulin resistance. And the problem with insulin is it's very inflammatory. So we want to try to keep that insulin down. How do we do that? We do that by eating high fiber foods that have low carbohydrate, low glycemic index. And the reason for that is it keeps inflammation down. And why do we care about inflammation? Inflammation sends all these different chemical signals through our body. And these type of signals are immune suppressants. Okay? And I'm not going to go through them all. They're all scientific. IL-6 is a very inflammatory substance. TNF-alpha, tissue necrosis factor alpha is, again, a very inflammatory. Leptin, when leptin goes up, we get this thing called leptin resistance. So now we don't get satisfied when we eat a nice meal. So it cascades. It cascades. So we've got to balance our inflammation. We need some inflammation. If I fall down and I bruise my knee, I need some inflammation because it protects me from bleeding to death. It helps heal me. However, if it becomes long-term inflammation, then we get some real problems. So we really want more anti-inflammatory action going on in our body and vessel dilation. So there's all kinds of ways that we can do that through beneficial bacteria, different herbs, botanicals, and other natural agents that can be used. They all can help, and they do it through two ways. They help strengthen our immune system if it's already weak, and they help educate and retrain that immune system so that it reacts properly. Okay, so the next portion of this is going to be strictly, I'm just going to talk about some herbs. It shouldn't take us a whole lot of time. I don't want to, I'm not here to try to sell a bunch of herbs or anything. I'm trying to give you information because people will come in and ask me what I recommend, and these are the things that Paul and I recommend, and these are the reasons why. However, I'm going to put my non-FDA approved disclosure on here. All these are herbs. The FDA does not approve herbs for, OTC use or as a drug use. So they're not, so there's the thing, you can read it. I think everybody's seen that on every bottle that we sell. Okay, so, first thing everybody always says is how much vitamin C should I have and why should I have it? Well, vitamin C is a fabulous antioxidant. A guy named Paulding actually got a Nobel Prize award for discovering vitamin C's effect on the immune system. Okay, so it's been known for years. By the way, he was also trying to solve DNA. Interesting work on how he and in the United States was trying to solve the DNA code, and the guys in England were also trying to do it. And so there's an interesting book that talks about their competition for that. His name is Linus Pauling. He's probably one of the greatest scientists of this last century in nutrition science, that is. But he was also very well respected on his work on DNA. But he was looking at how does the immune system really respond to different vitamins, et cetera. And he came up with all the theories on vitamin C and was able to prove a lot of these theories. Basically, we say 1 to 3 grams per day for colds is typical. And as we start moving into the fall season, vitamin C is never to be bad. You certainly can take vitamin C in the form of a supplement. You can take vitamin C in fruits and vegetables, okay? So, vitamin C is good, so you want to make sure you're getting your vitamin C. That's important. It helps improve those white blood cells, specifically the T lymphocytes. It increases antibody production. And of course, it is a major antioxidant. Other things that people don't always know about vitamin C, there are different forms of vitamin C. Probably the one called liposomal vitamin C is getting all most of the great press nowadays because it helps achieve better blood levels of vitamin C in the blood. And it helps get, they've been able to do some cell studies where they show that actually vitamin C can get into the cell better in this liposomal form. Vitamin C, if you're low on iron and your doctor tells you to take some iron, instead of cranking up your iron real high doses, you can take lower doses of iron and take it with vitamin C, and actually improves the absorption of vitamin C. One of the problems we have with iron is it tends to constipate. So by giving a little vitamin C, we can maybe use a little lower dose of iron and not get that constipation. Vitamin D, everybody's sunshine vitamin, right? We all know that we get it from sunshine. And, you know, there's some really interesting population studies as well as some smaller studies that look between as, you know, what happens when vitamin D levels start to dip. And one of them is a very good one that shows, a lot of studies show that there's an association between low vitamin D levels and increased respiratory infections. And in fact, even with the COVID outbreak, they were able to show that patients that had worse outcomes had lower vitamin D levels. So I will tell you that most integrative doctors in our area want patients to have a blood level between 50 and 80. It's a simple blood test. All the labs do it now. You can get, you know, so a lot of doctors are testing it. And that if somebody does get sick, we have some doctors that are that give a boost, like a 3-day boost of 25,000 to 50,000 units of D3 as a temporary boost. And I only do that for 3 days, and they take the rest of the week off. There is some concern that giving somebody too much vitamin D, especially if they have liver or kidney disease, there might be some issues. So it's not something we're going to publicly recommend, but that is something we do see, and it seems to work. I have personally done that, but I know what my kidneys look like and my livers looks like before I did it. Zinc gluconate, that's another one that's got some actually pretty good studies, and it's the gluconate and the acetate forms that have the best studies. These work on the rhinovirus, and one thought was that for the COVID virus, because that's a rhinovirus and it gets into the nasal sinuses, that the zinc gluconate might be one of the best forms of zinc to use. And so for the common cold, there are studies that show that it reduces the common cold by 3 days, and that you can give 9 to 24 milligrams of elemental zinc every 2 hours while awake, up to 75 milligrams, which is a, you know, pretty good dose. We don't typically recommend people take that much zinc every day, but if you take that for a couple days, it's certainly not going to be harmful. A couple caveats: you want to make sure that there are some drug interactions with zinc. So if you're on, if let's say you're sick and the doctor's got you on an antibiotic too, you want to make sure if it's a quinolone antibiotic like Cipro or Levaquin, that you're taking that about 4 hours away from zinc, because zinc will bind those antibiotics in the gut, so you can't, so they don't work. Also, if you take too much zinc, it can drop your copper. Copper is really important for red blood cells. We don't want your copper levels to go too low. Okay, beta-glucan, one of my favorites. This is one that I recommend quite a bit. Beta-glucan, on the bottles, a lot of times it'll say baker's yeast. It's really not a yeast. It is yeast-free. It's part of actually the mushroom family. It actually is part of the mushroom cell membrane. So it's found in mushrooms. It primes the immune systems by acting in neutrophils. So I tend to use beta-glucan a lot. I take it daily, kind of through the high period. So if you've got a lot of COVID infections going on and you're at work, or if you're exposed a lot. So like my daughter who's down in Kentucky working with kids, or working with adults, she's in this environment where she potentially gets sick. She's taking beta-glucan every day, and that's to help keep, it kind of helps pull the trigger on the immune system. It's cocking the trigger on the immune system. So it's ready to fire if it's needed to. And so it activates neutrophils, and the dose on that's 250 milligrams once a day for 4 weeks. And maitake mushrooms is another source that you'll see. Shiitake mushrooms, there are other forms that all have beta-glucan in them. In combination with beta-glucan is arabinogalactan. Arabinogalactan is a fiber that stimulates the natural killer cells, which also, again, helps rev up the immune system. It's a prebiotic that helps our probiotics grow in our digestive tract. So again, we talked about probiotics earlier. A prebiotic is something that kind of adds fuel that allows the probiotics to grow. It's dosed about 85 milligrams today for 4 weeks. A product made by Orthomolecular. It contains both beta-glucan and the arabinogalactin is whole immune. And we also have a Fort Wayne Custom RX brand of that product. Astragalus. Astragalus has been commonly used for cold and hay fever. It increases interferon, which slows virus replication. So interferon is antibodies. Okay, so again, the whole idea is it's stopping the virus once it starts to work. Elderberry. Elderberry is very popular right now. Elderberry is often used to treat a cold. It's often used for as a cough. We've used it in a lot of cough tonics. There are some great studies showing that it does help. It's used for prevention for traveling. If people tend to get, when you get on a plane, you're getting exposed. Usually start 24 to 48 hours after the onset of influenza. I think I misspelled that, influenza. Got too many, yeah, didn't I? Influenza. So echinacea. I like echinacea. Echinacea stimulates macrophages of the immune system. Those are the workhorses. It works 6 to 10 days for the common cold. It's dosed 6 to 10 days for the common cold. It's dosed 15 days for the influenza. A caveat on this one is if you have ragweed allergy, this is in the ragweed family, so you need to be careful taking it. Could make your allergies worse. What I do like about echinacea is there's a ton of studies. So here's one I'm going to just talk about real quickly. And I don't talk a lot about studies, but just to tell you, there can be good design studies, even if a drug's not FDA approved. So here's a randomized double-blind placebo, which typically means that patients either got echinacea or they got a placebo. They looked exactly the same, and the investigators, those that wrote the write-up, didn't know who was getting who, okay? So there basically was 755 patients. So when you do a study like this, you want to have at least 50 patients. So 755 patients is a good amount of patients, and half took it daily for 4 months. Of course, the other half took the placebo for 4 months. Oops. And here are the results. So they basically took this for 4 months to see, and they tracked it. And what I really like is the viral swab component of the study. So what they did was they actually tracked with the patients every single week and asked them if they were experiencing colds or anything. So they were very active in finding out how they did. And in the placebo, there was 188 colds, but in the echinacea, there was 149. The episode days, which would be the days that the patients suffered those cold symptoms, in the placebo group was 850, and the episode days of the patients taking echinacea was 672. So that's a pretty dramatic improvement. But here's the nice thing is that can be a little biased. You know, if somebody says, well, I don't know that I had a cold or whatever. The viral swabs is kind of a neat thing. They actually, when they had a cold or complained of a cold, they actually went in and did swabs. And they were actually able to grow. They had positive viral swabs on 74 of the placebo cases and 54 of the echinacea. So again, it's quite interesting to me. This is actually pretty hardcore that actually echinacea does work. Right now, I'm very big into quercetin. We use quercetin in a couple products. One is a product called DHIS by Orthomolecular. It's great for allergies. It's found in apples and onions. But you can also buy it straight up without stinging nettles, which is what's in the DHIS product, which has it. Stinging nettles we use for patients with urinary tract issues. We've used it the guys with BPH, etc. But quercetin, the other portion of it is what we're talking about today, and it's a combination found in resveratrol. And resveratrol, of course, everybody's hot on that for anti-aging now because of red grapes, right? So again, quercetin is found in onions and apples and I guess red grapes too, in the skins of red grapes. So it's a fabulous natural antihistamine. But what it's getting its claim to fame is it kind of works kind of like hydroxychloroquine maybe does. It works as what they call a zinc ionophore. Zinc helps get zinc into the virus, and zinc actually kills viruses. So if you can get it into the cell membrane, it actually can get into the virus and stop the RNA of the virus from replicating. So, so if you are low on zinc and you take quercetin, well, it may not work as well. So quercetin and zinc together are a great combination. It's dosed 250 to 500 milligrams twice daily, and I'm currently taking 250 milligrams every single day in my vitamins. I haven't been overly exposed, but if I thought I got exposed, I would double my dose, okay? And that is the end of my talk. And what did it take me? It took me about 45 minutes, which is about what I had planned, which then gives us plenty of time for questions and answers.
One thing I wanted to go back on real quick, Greg, when you talk about the echinacea and astragalus, I think, what was the product that you recommended?
The
Okay,
echinacea,
so this is
yeah.
immunosupport.
Yeah. So the echinacea product, okay, so that's a great question, Kylie. Would I buy every single one of these products? And I would not. I typically buy a couple, but I like combination products. So immunosupport has combinations of many of the different products we talked about in here, and that's why I'm big on it, on immunosupport. So how I use this is on the first product up here, which was the immunodefense, okay, is straight beta glucan and arabinogalactin. And what I do on that is I take that every single day. And
That one is more to prep your
immune system, right?
Okay.
So this is our brand of Whole Immune.
Okay.
Whole Immune is made by Orthomolecular, and guess who makes our product, the Immune Defense? Orthomolecular. They actually make it for us, and we just put it in our own bottle, and I save 10%, which I pass on to the patient because we want them to buy our brand, of course. So, this product is what I take during cough and cold season. Specifically, I started it up about October, and I take it through January, February when it's real bad. Now this year, I'm taking it pretty much every day. Okay.
And it's okay to take every day.
Yeah.
Yep. Okay.
Okay, because it's just priming. Now this product over here, immunosupport, this product's the one you take if you suspect you're infected.
Okay.
It's got a little quercetin in it, so it's 50 milligrams. I still take the higher dose quercetin every day, and I take my zinc every day. I make sure my vitamin D level's good. But if I feel like I get exposed or I'm not feeling good, I feel like something's coming on, this one I start right away, and you can take it very aggressively. You can take 2 capsules every 2 hours if you wanted to around the clock. And again, it's a combination product, so it's got a lot of the different things in it.
This product in particular is the same as Viracid, made by Orthomolecular as well.
Same as Viracid, thank you.
Okay.
I could have put a picture of both on there.
Yeah.
That would have been less confusing.
So then quercetin, if you're taking the immunosupport, say you have cold symptoms and you're taking the immunosupport to kind of fully boost your immune system,
Mm-hmm.
take quercetin on top of that, or when would you take?
If it depends on how much I'm going to take. So if I'm going to take, like, let's say 8 capsules a day, you're going to get 400 milligrams of quercetin.
Okay.
You don't need to take, but if I'm only going to take a couple, then I could take the quercetin on top of it.
You want to stay between the 250 and the 500
Right.
grams.
That's where most of the studies are showing.
Okay.
Can it be harmful? It doesn't appear that it is, you know. And just to let you know, we all talk about, you know, eating fruit. Oops, there's my picture of my apple. There it is. That's only got like 6 milligrams of quercetin in it. So you're not getting very much quercetin in there.
Yeah. You need extra boost.
You'd have to eat a bag of them, which,
Gotcha.
you know, you have Apple Fest. I like that. So yeah,
They're not having Apple Festival.
oh, doggone it.
Here.
Yeah.
Okay. Well, at this time, we'll just go ahead and leave it open for any questions that we could answer. If anybody has any questions, we will go through and answer. But I would like to go back to the last page, the events.
Sorry.
Okay.
I do that.
So we do have some upcoming events. Like we said in the beginning, this is our first webinar, but we have scheduled out a few more currently, and we plan to schedule them out through the rest of the year at least. So I know Saturday, if you're interested, there we go. Saturday, which is August 22nd, that's this Saturday around 9 a.m. usually, Greg.
It is 9 a.m.
It is this
Get that
week.
confirmed.
Okay.
Yeah.
Greg will be on the Health Call live show on WOWO,
We're going to talk about cholesterol.
cholesterol and heart health. Yeah.
Mhm.
We also have a promotion going on for that for 20% off all of our heart health products. Those are the red label products on our Fort Wayne Custom RX premium line brand. So you can find our premium line brand in the middle of the store, right around the light. So anything in red is going to be 20% off for the Health Call Live on WOWO. So we wanted to let you know that. And then Thursday, September 10th at 7 p.m., we also have another webinar scheduled. That one is on low dose naltrexone. So, and then a couple weeks following that, I think it's exactly 2 weeks. Are we thinking about moving that one to Tuesday?
I get moved to Tuesday. So-
Okay. So that one only had to be Tuesday or Thursday. We're not exactly sure yet. So the 22nd or 24th at 7 p.m. That'll be adrenal support, another webinar. So it'll be the same way. You just give us your email and let us know you're interested in that webinar or any of the webinars. And we will send out an email for you to register, and then you'll get the link shortly after that. And yeah, I think you can call us and let us know. You can send an email to Kylie, that's Kylee at fwcustomrx.com, and just let me know which email address you'd like the link sent to, and I will send that to you.
Okay, well, thank you all for joining in on my first talk. I think we went through pretty good for the first time, and thanks for spending your evening with us. And of course, if you have any questions at all, feel free to give myself a call or Paula at the store. We're happy to help you at any time. Have a good night, and I guess I'll see you guys tomorrow.
All right, Greg, thank you.
Thank you.
Thanks.
Yeah, I guess I just hit end.
Maybe.
Okay, end meeting for all.